नमस्ते नमस्कार म सञ्जिता पण्डित एकचोटि फेरि वेलकम गर्दैछु यहाँलाई मेडिकल विथ सन्जुमा। आजको क्वेसन हाम्रो रहेको छ एबोर्सनमा। योभन्दा पहिला हामीले एन्टिपार्टम हेमरेज अथवा प्लेसेन्टा प्रिभिया एन्ड एब्लेटिभ प्लेसेन्टाको बारेमा हेरेका थियौं। क्वेसन नम्बर 546 एट व्हाट स्टेज fetus is viable at international level? Option A 16 weeks, option B 18 weeks, option C 20 weeks and option D 28 weeks. इन्टरनेशनल लेभलमा 20 to 24 weeks हुन्छ। अप्सन सी इज राइट आन्सर। क्वेसन नम्बर 547 एबोर्सन अकर अप टु जेस्टेसन अफ अप्सन ए 32 weeks, अप्सन बी 24 weeks, अप्सन सी 36 weeks and अप्सन डी 40 weeks. Abortion term used till the period of viability of a fetus. According to the WHO 22 week हुन्छ। After diet premature labor term will be used. Option B is right answer. Question number 548. The expulsion of an embryo or fetus before it is viable is called. Option A surgical abortion, option B abortion, option C miscarriage and option D medical abortion. This is abortion. Option B is right answer. Question number 549. Type of abortion in which the changes have reached a state where continuity of pregnancy is impossible. Option A threatened abortion, option B inevitable abortion, option C missed abortion and option D septic abortion. There are many types of the abortion. Threatened abortion, inevitable abortion, missed abortion, septic abortion, incomplete abortion, complete abortion, etc. In threatened abortion, cervix close हुन्छ, mild pain हुन्छ र continuity of pregnancy possible हुन्छ। मेन भनेको continuity of pregnancy possible हुन्छ। Inevitable abortion मा opposite of threatened abortion, यसमा cervix open हुन्छ, पेन हुन्छ, ब्लिडिङ पनि हुन्छ र कन्टिन्युटी अफ प्रेग्नेन्सी इम्पोसिबल हुन्छ। मिक्स्ड एबोर्सनमा फिटसको डेथ भइसकेको हुन्छ तर कुनै सिम्पटम्स हुँदैन, इनसाइड द युटेरसमै हुन्छ फिटस। सेप्टिक एबोर्सन मिन्स इन्फेक्सनले गर्दा यदि एबोर्सन भएको छ भने त्यसलाई सेप्टिक एबोर्सन भन्छ। यहाँ दिएको क्वेसनमा के छ, स्टेट वेयर कन्टिन्युटी अफ प्रेग्नेन्सी इज इम्पोसिबल भनेको छ हैन। कुनमा हुन्छ इम्पोसिबल? इनिभिटेबल एबोर्सनमा। अप्सन बी इज राइट आन्सर। क्वेसन नम्बर 550 moderate to heavy vaginal bleeding in early pregnancy associated with open cervical OS is referred as. Option A spontaneous abortion, option B threatened abortion, option C inevitable abortion and option D incomplete abortion. Just भनेको open cervical OS, vaginal bleeding and continuity of the pregnancy is impossible in a inevitable abortion. Option C is right answer. Question number 551. A clinical entity where process of abortion has started but has not progressed to a state from which recovery is impossible is. Option A spontaneous abortion, option B threatened abortion, option C inevitable abortion and option D missed abortion. यहाँ नेगेटिभ क्वेसन दिएको छ, not progress to a state from which recovery is impossible. That means continuity of the pregnancy is possible. In the case of threatened abortion, option B is right answer. Question number 552. A 27 years old woman is admitted to the hospital with spotting for vagina but no pain. Her history reveals 3-month amenorrhea and confirmed pregnancy test after her first missed menstruation period. She is suspected to be a case of abortion. Which type of abortion is suspected most likely? Option A, missed abortion. Option B, inevitable abortion. Option C, threatened abortion. And option D, incomplete abortion. फर्स्टमा क्वेसनलाई बुझ्नु के भनेको छ स्पोर्टिङ फर भेजाइना बट नो पेन एन्ड 3 month एमेनोरिया भनेको द्याट मिन्स स्पोर्टिङ छ तर पेन छैन सर्भिक्स क्लोज होला एन्ड कन्टिन्युटी अफ द प्रेग्नेन्सी पोसिबल छ रेस्ट गर्यो भने बेड रेस्ट यसको ट्रिटमेन्टमा मेन भनेको बेड रेस्ट आउँछ यो थ्रेटेन्ड एबोर्सनमा आउँछ अप्सन सी इज राइट आन्सर क्वेसन नम्बर 553 bleeding in the first trimester with no uterine contraction or pain and no dilation of cervix indicates option A missed abortion, option B threatened abortion, option C inevitable abortion, and option D complete abortion. No uterine contraction, no pain, no bleeding, no dilation of cervix is in threatened abortion. Option B is right answer. Question number 554. Vaginal bleeding occurring before 28th week of gestation indicate incomplete abortion, inevitable abortion, missed abortion, threatened abortion. In threatened abortion, option D is right answer. Question number 555. In whose type of abortion is the fetus dead and retained inside the uterus for a variable period? Option A, inevitable abortion. Option B, incomplete abortion. Option C, missed abortion. And option D, threatened abortion. A type of abortion in which the fetus has died, but the product of conception are retained in the uterus for 8 weeks or longer called missed abortion. Option B is right answer. B मा दिएको छ missed abortion. Question number 556. Dark brown vaginal bleeding and a negative pregnancy test is seen in which abortion? Option A, threatened abortion. Option B, imminent abortion. Option C, missed abortion. And option D, incomplete abortion. Mixed abortion मा हुन्छ option C is right answer. The clinical features of missed abortion are dark brown vaginal discharge, retrogression of breast change, spotting of uterine growth, absence of FHS, and negative pregnancy test. Question number 557. Robot sign is found in option A, placenta previa, option B, abruptive placenta, option C, IUFD, and option D, hydatiform mole. Robot sign is found in intrauterine fetal death. Option C is the right answer. Question number 558. Which sign is seen 1 week after an intrauterine fetal death due to irregular overlapping of cranial bones with liquefaction of brain matter? Option A, stay-worthy sign. Option B, placental sign. Option C, Iskasek sign. And option D, Spalding sign. Right answer is option D, Spalding sign. Question number 559. What type of abortion is caused when there is little bleeding and nothing is expelled from uterus? Option A, habitual abortion. Option B, incomplete abortion. Option C, suspected abortion. And option D, complete abortion. This is suspected abortion. Option C is right answer. When there is a little bleeding and nothing is expelled from uterus, it is considered as to be suspected abortion. Question number 560. Involuntary loss of product of conception prior to 24 weeks of gestation is known as option A, spontaneous abortion, option B, threatened abortion, option C, inevitable abortion, and option D, incomplete abortion. Spontaneous abortion. Option A is right answer. Question number 561. The most common cause of spontaneous abortion is option A, physical trauma, option B, congenital deformity, option C, unresolved stress, and option D, germplasm defect. Germplasm defect. Option D is right answer. Question number 562. The cause of recurrent abortion in mild trimester pregnancy include option A, retroverted uterus, option B, cervical incompetence, option C, defective Mullerian fusion, and option D, A, B, and C. Recurrent abortion means cervical incompetence. Option B is right answer. Question number 563. Cerclage, encircling cervix with suture, is done for patient with which abortion or condition? Option A, complete abortion. Option B, incomplete abortion. Option C, incompetent cervix. And option D, threatened abortion. Cerclage is a type of suturing. र यो इन्कम्पिटेन्ट सर्भिक्स अथवा रिकरेन्ट एबोर्सनमा गर्छ जसमा के हुन्छ सर्भिक्सको चाहिँ ओपनिङ त्यो जुन इन्लार्ज हुन्छ त्यसलाई सानो गर्छ जसबाट चाहिँ के हुन्छ एबोर्सन चाहिँ हुँदैन क्वेशन नम्बर 564 MC Donald suturing is done in option A missed abortion, option B septic abortion, option C recurrent abortion, and option D complete abortion. सर्क्लाज अपरेसन दुई किसिमको हुन्छ सिरोडकार एन्ड एमसी डोनाल्ड अपरेसन जुन 14 विक्स अफ द प्रेग्नेन्सीमा गर्छ यो रिकरेन्ट एबोर्सनमा गरिन्छ अप्सन सी इज राइट आन्सर रिकरेन्ट एबोर्सन एन्ड इन्कम्पिटेन्ट भनेको उस्तै हुन्छ क्वेशन नम्बर 565 which should be carefully assessed by nurse during giving nursing care of a mother with spontaneous abortion. Option A hemorrhage, option B dehydration, option C hypertension, and option D subinvolution. Hemorrhage को केसमा option A is right answer. Question number 566. A septic abortion where the infection spread beyond the uterus to the parametrium, tubes and ovaries or pelvic peritoneum is considered. Option A grade 1, option B grade 2nd, option C grade 3rd, and option D none of the above. Septic abortion means any abortion which is associated with the infection of uterus or product of conception called septic abortion. There are 3 grades of septic abortion, grade 1, 2 and 3. In grade 1st, infection located in the uterus only. In grade 2nd, infection spread beyond uterus, tube, ovaries or pelvic peritoneum. And in grade 3rd, infection generalized peritonitis. That means it spread out of the uterus and other body part. So, यहाँ दिएको पेरिटोनियममा tube ovaries, these all in grade 2nd. Option B is right answer. यहाँ explanation हेर्न सक्नुहुन्छ. Question number 567. All of the following are symptoms of incomplete abortion except option A, history of bleeding for vaginum, option B, uterine size less than paired of amenorrhea, option C, closed cervical OS, and option D, history of passage of product of conception. Option C, closed cervical OS is not in incomplete abortion. Open huncha, close open huncha cervical OS in incomplete abortion. Question number 568. Active management of patient with missed abortion at 12 weeks of gestation include A. Vaginal evacuation, B. Accelerate uterine contraction by oxytocin drip, C. Slow dilation of cervix by laminaria etent, D. Suction evacuation. Option A, ABC. Option B, BCD. Option C, ACD. And option D, ABCD. A, C, D. Option C is right answer. Question number 569. 32-year-old mother with 30 weeks pregnancy have a vaginal bleeding. What should do? Buy nuts first. Option A, apply pad. Option B, arrange for LSCS. Option C, perform delivery. And option D, check FHR. First of all, apply pad to assess amount of blood loss in the priority nursing action. Question number 570. Kerman tap catheter is used in condition. Option A, retention of urine. Option B, vacuum drainage. Option C, abortion. And option D, vacuum extraction. Kerman tap catheter is a catheter used for suction cuvettes of the uterus for abortion. Option C is right answer. Abortion को किस में use कर सकते? Next question on ectopic pregnancy in other video. Thank you so much.